Hi everyone, welcome back to the Vision Refocused channel where we discuss all things eye health and vision related. I'm Dr. Kevin Cornwell, and today I wanted to go over one of the most common eye conditions we see in clinic, and that is the development of a cataract. In this video, we'll look at what a cataract is and how it occurs, as well as some common visual symptoms that are associated with them. We'll review how they're managed and treated, and lastly, we'll end by looking at whether or not there's anything you can do to avoid developing this sight-threatening eye condition. Let's jump right in. So to better understand what a cataract is and how it can affect our vision, we first need to review some basic anatomy of the eye. As light enters our eye, it bends as it passes through two different structures with the ultimate goal of focusing a clear image onto the retina, which is in the back of the eye. The first structure that bends the light is the cornea, which is the clear front surface of our eye. The light then gets bent further as it passes through our lens, which is located immediately behind our iris. Our lens has the unique ability to flex, which adjusts how much further light gets bent as it enters our eye. Over time, the proteins in the lens begin to break down, causing it to harden and making it less flexible. This is partially why people who turn 40 are no longer able to focus up close comfortably, but we'll save that one for another video. The lens can eventually become cloudy and opaque through this process as well, and it's at this point where we start to see full-fledged cataract formation. So we usually tell patients that if you live long enough, eventually everyone's going to develop some form of cataract with their eyes. This process can occur for several reasons, with your number of birthdays being the most common risk factor. Other risk factors for developing cataracts include smoking tobacco, excessive UV exposure, eye trauma, diabetes, as well as taking certain high-risk medications like corticosteroids. Cataracts can develop at different rates in different people. In otherwise healthy individuals, visually significant cataracts typically don't develop until after age 65. I've seen patients in their late 80s who have mild cataracts but are still totally happy with their vision. Patients with any of the other risk factors we just discussed may develop cataracts much earlier, even in their 30s or 40s. It's fairly uncommon, but congenital cataracts can also be present at birth. Most people with early cataracts won't notice any changes to their vision. As things progress, patients tend to complain that their vision seems blurry, distorted, or hazy in one or both eyes, kind of like they're looking through a foggy windshield. Other visual symptoms with cataracts can be double vision, reduced perception of color, as well as increased light sensitivity, especially at night. As cataracts develop, even with the most updated glasses prescription, a patient's vision still isn't quite right. This is usually a slow process over months to years. Unless both eyes are affected, most patients may not have any visual symptoms until the more advanced stages. Patients may get frustrated after getting multiple pairs of new glasses and still not being able to see as well as they'd like to, which often means they would benefit from a cataract surgery. Treatment for cataracts largely depends on the degree to which a patient's vision is affected. For patients with early cataracts who are asymptomatic for any vision changes, we typically just monitor these cases on an annual basis, while also recommending the importance of UV protection, as well as addressing any underlying risk factors such as smoking cessation or blood sugar control for diabetics. Cataract surgery is ultimately the solution when cataracts progress and begin compromising a patient's visual function and daily activities. This is one of the most common surgeries performed worldwide and involves surgically replacing our natural lens with an artificial one that's custom tailored just for us. Another neat thing about cataract surgery is the ability to incorporate a patient's glasses prescription into that new lens implant, making them less dependent on glasses after the surgery is performed. For those patients that are still happy with their most updated glasses prescription and still meet their state's visual acuity requirement to obtain a driver's license, I usually just say it's totally up to you whether or not you should get cataract surgery. It's in the cases where the vision has been reduced to the point where they would not pass the vision test at their DMV, or they're no longer happy with their vision to perform their daily activities that I highly encourage cataract surgery, or consider forfeiting their driver's license, which nobody wants to do. So surgery is ultimately the solution in those cases. Every state's a little bit different as far as the visual acuity requirement to drive, so check with your state. It's typically between 20/30 and 20/50 visual acuity. Patients will often ask if there's anything they can do to avoid developing cataracts in the first place. Because visual changes may not occur in the early stages of cataract formation, it's important to have an annual comprehensive eye exam by your trusted eye care provider. As we discussed, other controllable risk factors should also be addressed and managed. When cataracts are diagnosed early, most patients are able to maintain their vision and quality of life for years or even decades before requiring surgery. So there you have it. I hope you found this video useful in learning more about what cataracts are and how they can affect your eyes and vision. If you have any further questions, feel free to leave a comment and I will get back to you. Also, if you have any ideas for eye-related topics you'd like to see covered in a future video, please let me know as well. For more videos on eye health and vision, feel free to check out the other videos on our channel and subscribe. Thanks again for watching, and we'll see you in the next video.